of you know, we have been conducting these webinars based on the WHO 14 primary healthcare levers. Before we head into our webinar for today, allow me to speak about the International Institute for Primary Healthcare in Ethiopia. International Institute for Primary Healthcare in Ethiopia is established by the Federal Ministry of Health with the support from Johns Hopkins University and financial support from the Gates Foundation. The Institute envisions to become a center of excellence in primary healthcare. To this end, the Institute has been working towards capacity building of the Ministry of Health, with engaged in the knowledge generation in management, both in Ethiopia and globally. It also advocates primary healthcare at national and global level. So today's webinar will be focused on primary healthcare, implementation research for primary healthcare. Allow me to introduce you to our moderator for today. Prof. Getnet Matiki is our moderator. He is a medical doctor by training. He holds a master's degree in public health and PhD. He is a senior research advisor at the International Institute for Primary Healthcare with extensive experience in health teaching, training, research, and consultancy services. He has several publications on priority health conditions and health services, including a recent book on the health extension program of Ethiopia. He leads implementation research section of the knowledge generation in management and for informing policy and program improvement for primary healthcare. His work focuses on the identification of implementation gaps, documentation of programs, generation, synthesis, and sharing of evidence to inform primary healthcare system and programs. He collaborates with the Ministry of Health and governmental organizations, national universities, global partners, and research institutions. He also holds an adjunct professor position at Bahir Dar University, Ethiopia. Welcome, Prof.
Thank you very much. Thank you very much, Dr. Antana, for your kind introduction. Hello, everyone. Maybe good morning, good afternoon, and good evening, because we might be in different time zones. So I think some of how we manage the time has been already done. So there will be 10 minutes presentation for each, and then we will have more time on questions and answers. So allow me to introduce really two distinguished people, experts, to present on implementation research for in primary health care. First, maybe we will start with Dr. Olakunle Alonge, and then we'll proceed with Dr. Alemayo from global to national experiences. So let me introduce Dr. Olakunle. Dr. Olakunle is a public health physician. He is an associate professor at Johns Hopkins University, International Health. His expertise is particularly on implementation science and also health systems research. He has extensive experience in that area. Particularly, he is interested or working in advancing implementation research and methods to improve programs, health systems, strategies, and initiatives. Especially, he focuses on injuries, communicable diseases, non-communicable diseases, mental health, and also addressing inequity. He leads systems and translation of research and innovation, particularly the polio eradication from the polio eradication program, which is called STRIPE. and he works at global level, particularly in some countries like Afghanistan, Bangladesh, Democratic Republic of Congo, Ethiopia, India, Indonesia, Nigeria. He has been working, and he's still working with these countries. And he also works, again, as I said, to improve health services and health systems besides implementation research. So that's briefly my introduction of Dr. Kunle. Then I will introduce briefly at the same time Dr. Bakkala Balaihun. But Dr. Bakkala holds really he got his bachelor's and master's degree from from Hawassa University, and then a PhD degree from the University of South Africa. He has 13 years experience, particularly in monitoring, evaluation, and learning, and in implementation research, particularly focusing on organizational development, also on decision making. Currently, he's working for Pathfinder International as a senior research advisor. Also, he assists the Ministry of Health, being a member of the Research Advisory Council, and he has many publications, greater than 65 publications, peer-reviewed, and also books and other materials. Actually, he has also received a Young Public Health Research Award by the Ethiopian Public Health Association at annual conference, 33rd annual conference. So I would like to thank both presenters, the distinguished presenters, and then would like to call upon Dr. Kunle to start his presentation, and then we'll proceed to the next presentation. Dr. Kunle.
Thank you very much, Professor Getnet, for the kind introduction. And colleagues and participants from Ethiopia and the rest of the world, welcome. And it's really my pleasure to be with you this morning. I have a couple of slides that I would run through in 10 minutes. And the goal today is really to describe what implementation research is. I know it's like the buzzword, but when we say implementation research, what do we mean? And in describing implementation research, I'm going to compare it to some other types of studies and give some example. I mean, give one case example of an implementation research that I've been that I have led and others have worked with that I've worked with others on, and then we would wrap up. So, what is implementation research? Simply put, implementation research is the scientific inquiry into questions concerning implementation. That is the act of carrying an intention into effect, which in health could encompass policies, programs, and individual practice. So this definition really set the stage for implementation research, and it focuses the research on implementation as opposed to focusing research on intervention. You know, for most of us, traditionally, when we think about health research, we always think about it in terms of an intervention. We think about it in terms of the effect of the intervention, and we think about it in terms of outcomes of the intervention. But what implementation research does is that it takes attention away from trying to establish evidence on the efficacy of an intervention to looking at providing evidence for effectiveness of the implementation of the intervention. So you really focus on the process of doing an intervention, the process of carrying an intervention into effect. So it's really that research around processes used to implement policies and interventions and some of the contextual factors that affect those processes that implementation research covers. And indeed, implementation research often presupposes that there is some efficacious intervention. And where it begins to operate is to think about how do we take this efficacious intervention to achieve its impact within real world condition. That is to say, it really addresses the how and the why and what is implemented and their effect in real world setting. So it's really unlike our traditional approach to research, where we try to control everything that is controllable. We try to control the context, we try to control the strategies. Implementation research does the exact opposite. It focuses on the context, it focuses on the strategies, it focuses on the process by which we carry out an intervention into effect. So there are broad principles that guides the conduct of implementation research. For another way of saying that is there are features that distinguishes implementation research from other kinds of research. Obviously, the first is really the feature around the way we define implementation research. Like I said, implementation research focuses on questions and outcomes around implementing and evidence-informed interventions. And the second key principle is that it's research that is conducted under real-world conditions, unlike our traditional efficacy research, which is often conducted under controlled setting, where we control the population, we control the recruitment strategy, we control the strategies, we control the context. In implementation research, we do not control these because we really want to see how and why an intervention will lead to an outcome under those conditions. And therefore, it should provide evidence for how and why evidence-informed interventions leads to health impact. And it does this by using different tools. There are different tools that are available to us in implementation research. It includes tools such as implementation research outcomes, implementation research strategies, and pragmatic research paradigms and designs that allows flexibility to looking at multiple outcomes, including outcomes of population health, and outcomes of implementation, and combining these different outcomes to figure out the pathways by which an intervention leads to impact. So therefore, the design of implementation research should be fit for purpose. It should respond to the immediate implementation problems, while at the same time balances the need to be able to generalize such knowledge beyond the setting in which the studies is being conducted. And then you would see that a lot of these requires, to undertake such a study would require multi-stakeholder collaboration and partnership. So oftentimes implementation research is conducted not just only by the researcher, but it's conducted by teams that combines researchers, practitioners, donors, community members, and so on. And context, again, is king in implementation research. Unlike our traditional efficacy research where we control context, context is a focus in implementation research. Implementation research is shaped by context. And by context, I mean the political environment, the political economy, the health system environment in which the implementation research is done. I'm talking about the social conditions in which people live, in which people work, and some of the factors that are related to the implementing organization and to the culture, to the climate, to the attitude of the peoples, either the beneficiaries or the implementers. And there is a whole spectrum of research questions that we can address in implementation research. I will not belabor this slide, but this is really just to show to you how we think about research from our basic research where implementation is not relevant. For instance, we are trying to find out the safety of a pharmacological agent, or we're trying to understand some phenomenon within population where implementation is not relevant. And then we gradually progresses onto instances where we try to determine the efficacy of questions around efficacy of intervention and questions into effectiveness of implementation approaches for the intervention. And that's really where implementation research questions sit. It begins to sit from the fourth bullet from my left. Here we implementation studies as contributing factors. Our research questions around implementation research is really a question around the effectiveness of the program in all of its variation. So we are considering all of the different computations of the implementation activities. We are looking at strategies. We are testing strategies. We are looking at implementation outcomes to understand the result of those strategies and the intervention. And we are using flexible, pragmatic designs to conduct these studies. And then, of course, to the whole extreme where implementation is the entire focus. So I've provided some of the references so that you could actually take a closer look at some of these studies. So how does this implementation research compares to our other common studies that we're familiar with in public health? If you think about the pipeline for producing intervention and for generating evidence for intervention from our T1 studies are basically safety trials or trials where you're trying to think about whether something has any property, any pharmacological property, or you're trying to understand perception around a specific phenomenon. That's not implementation research. Those are T1 studies. So our T2 studies, which are often around establishing efficacy for an intervention. So those are phase 3 clinical trials, where you're trying to, you look for whether an intervention is efficacious. And in doing that, you control the population, you carefully select the population that you study, you carefully select the environment in which the study is conducted, and so on. That is also not implementation research. That's really why you see that they are outside of the circle of implementation research. But by the time you begin to think about T3 studies, where you are taking an efficacious intervention into real-world population, you are trying to see how it works under real-world condition, under usual practice, and you're trying to disseminate those practices across the healthcare delivery system, or you're trying to look at how it interacts with the health system largely and the political context largely, you begin to think about those questions are around questions of implementation research. So our dissemination and implementation activities on that T3 studies really fall squarely into implementation research. And also T4 studies where you're actually looking at implementation effectiveness. So you're looking at scaling up, you're looking at sustaining an intervention over time under real world condition, our whole implementation research. And then you will see that the definition of implementation research overlaps other kinds of studies. So for instance, some of our quality improvement studies where we're trying to improve quality, addressing a quality problem in clinical care could rightly fit within implementation research as long as it is focused on implementation processes. It's focused on improving implementation processes for delivering an efficacious intervention. And similarly, operation research where you're trying to make decisions based on model speculations, it could also fall within implementation research to the extent that those modeling are focusing on processes and they're focusing on understanding pathways for effective implementation. And again, monitoring and evaluation studies, traditionally, which looks at specific end outcome, look at particular input and an outcome, could actually also encompass implementation research to the extent that it's looking at the process by which different activities, different programs are producing their effect or are not producing their effect, and looking at processes, outcomes, and so on to examine those relationships. So again, the borders are a little bit fuzzy that's really why you have the serrated border around the Q1 study, operation research, and the M&E, in that they actually do overlap implementation research to a great extent. So this slide, it really builds upon what I've described earlier on, and it really just gives you some perspective of the origins of implementation research. Typically, implementation research originates from multiple disciplines. It originates from management in the conception around management improvement, quality improvement. It originates from engineering that looks at systems, processes, how to improve system processes, system engineering, the engineering procedures. It also operates it originates from mathematics. The principle around operation research really stems from mathematics, from engineering, and from policy. The whole idea of top-down, bottom-up policy implementation from political sciences, public policy, and so on. And of course, from where a lot of us come at it, epidemiology, biomedical sciences, behavioral change, sociology, education, and so on. So implementation research really has multiple origins. That's the essence of this slide. And there are multiple traditions. So it's actually multidisciplinary in that sense. And in the application of all of these different disciplinary approach, it's also interdisciplinary because you are borrowing concept and construct and designs from different disciplines in order to specify questions, to answer questions, and to disseminate your result. So for the sake of time, I won't belabor this, but I was just going to talk about a case example of an implementation research. I see the hands, and I think we will have a dedicated time for questions and answers. So you can put your questions in the chat. After now, we will take a look at them. And so this is really just an example of a study that we had conducted in a study that you conduct at a national level and how it could be global in scale. We had looked at drowning, which was a common cause of death. It was the top cause of death for children between the ages of 1 to 5 in Bangladesh and in a lot of countries in the world. And there were candidate interventions that have been found to be efficacious. So putting children in daycare was one of such interventions. But in this implementation research study, what we decided to do was to see how would this intervention work in real work conditions. That is, considering all of the different variations by which it's going to be implemented. So we implemented it across different settings, across different administrative geographical regions, across different implementation arrangements and so on, in order to be able to test the effectiveness. And then we looked at specific implementation strategies that could be used to facilitate the daycare intervention in those different settings. And lastly, we did not just only look at the outcomes of mortality, that is drowning specific mortality, but we're also looking at acceptability of the intervention with the different stakeholders. We're looking at arrangement for organizing community and for organizing delivery of the intervention at the community level and so on and so forth. And we're also looking at the costing, the cost effectiveness of the intervention within all of this arrangement. And we're able to show at the end of the day that not only was this intervention efficacious, but it was also effective. And there are certain implementation arrangements that allows for the effectiveness. And this facilitated the scale up of the intervention and the adoption of this as a major strategy by the United Nations resolution for global drowning prevention, and it's really one of the mainstay for drowning, for childhood drowning prevention in globally, and it's really just an example to show you how implementation research can inform global policy, and implementation research can inform scale up, can inform sustainability, and using a flexible research design that allows you to study both clinical outcome, implementation outcomes, and that also allows you to convene stakeholders across different levels and look at mechanisms by which intervention leads to their outcome, really paves the way for scale up, paves the way for sustainability and widespread adoption. So this again, I would run through this quickly. How is implementation research has been applied in low and middle income countries? So given all that I've said, we still see that there is still a missed opportunity when you look at the global literature, particularly focusing on low and middle income country settings. We find that implementation research is still grossly underutilized. So there was a systematic scoping review that we had conducted some years ago, looking at papers published over a 10 years period, and to try to look at how they used implementation research design and certain features of implementation research. And to a large extent, our conclusions were that there are still a lot of opportunities for the adoption of implementation research to bridge the evidence to action gap, particularly in delivering health programs and also in strengthening primary health care delivery systems across the globe. So there are candidate intervention. For instance, we have some of the community extension programs in Ethiopia. We have some of the effective integration agenda in different countries that are really piped for scale up. But we need to understand how and why this intervention work. We need to understand the mechanisms, the pathways by which all of this intervention work. And implementation research can actually, it can respond to that. So what are some of the competencies or skill set that you need in order to do implementation research? We have a paper on that based on some stakeholder review across different countries in the globe and working with different UN agencies, including WHO, to identify specific competencies that people who are working in implementation research need. Firstly, all of these competencies are things that it's almost improbable that one individual will embody all of these competencies. So it's again going back to that point that implementation research is done by team. But we're able to identify at least 11 domains and close to about 59 competencies and 52 sub-competencies that is required for implementation research team. This cut across working with stakeholders, engaging stakeholders, how to engage with stakeholders, how to identify stakeholders, how to collaborate with stakeholders, and working within context, how to analyze context, how to analyze health systems, how to look at for bottlenecks, facilitators, and how to integrate solutions. And also to rigor, how to conduct research in a way that it is internally valid, you know, the way you develop your question, the design, the kind of pragmatic design and methods and issues around ethics of conducting research and so on. And to understanding the practice side of research, how you leverage resources for conducting research, you know, how you use resources as the focus of research, how you develop proposals, how you prioritize research questions, how you finance, and again, to communicating and to knowledge translation, how you package knowledge, how you communicate it effectively, how you identify dissemination channels, communication channels, and the strategies for doing all of that. So again, this reading, I think if you're interested, you can review some of the reading. So in conclusion, implementation research is the scientific inquiry into questions concerning implementation. It is interdisciplinary and has origins from multiple disciplines. And there is really still a lot of opportunity for us to begin to use implementation research in low and middle income country setting. And it has a great promise for addressing the evidence to action gap in healthcare, including primary healthcare delivery. Thank you. So I'm going to turn it back to the Professor Getnet now.
Thank you very much, Dr. Olakunle. Really, this was an exciting presentation. You have given us really the definition so that it's clear to everybody, including the broad principles, the context, the spectrum of implementation research with other, common studies that we conduct, epidemiology or other, systems, and also implementation research and its traditions or origins. We had an example from Bangladesh, and also its application in least and middle income countries with some of the limitations we have. And I think it was good also you covered the core competencies so that we understand it better, and that was concluded. And thank you very much. We have a few questions that we'll come back to, and we'll come back to them later on at the end of Dr. Bakkala's presentation. So now we can directly proceed to Dr. Bakkala's presentation, and then we'll go to the QA towards the end. Thank you very much again. Dr. Bakkala, the floor is.
Thank you, Prof, for your nice introduction, and Dr. Olkan for your nice presentation. For overall understanding of implementation research and health research in general, it's an essential components of overall health system he mentioned in his presentation. In general, implementation research is an integration of findings into healthcare practice. So implementation research is using the finding from the previous research practice in general. He said it addressed for the feasibilities and the cost effectiveness and sustainabilities, and also the acceptability and the quality and equity of access and the compliance of the intervention. Thank you for your nice presentation. My presentation is focusing on the health status, the implementation status of Ethiopian and Pathfinder experience in general, and also the way forward and the take home. In implementation research in practice in public health it's finding and testing the strategies that are addressing the program and constraints. It is to inform broader action to mitigate system barriers. It is also a good instrument to promoting a culture and a practice of learning with local health system, including for the continuous responding and adapting and improving the health systems. It is good to see the differences and with other aspects of research type he already mentioned. The health status of research in Ethiopia in general, research is primarily undertaken in academic institution. However, most of research institutions outside of the teaching institution, including Ethiopian Public Health Institution, Institute, AHRI, and other research institutes are among other engaging in implementation research at national interests. So the institute conduct a number of breakthrough research with numerous peer-reviewed journal publication. Some of the implementation research activities have a direct impact on the health system, policy and activities that are directly planned as part of the health sector research agendas. The Ministry of Health also undertake implementation research directly or indirectly, focusing on the major public health research issues. And also the Ministry of Health established a research advisory council, one for RMSH Research Advisory Council, and the other is Tuberculosis Research Advisory Council, to build the capacities and generating and use of evidence to inform health policy and practice. The council produced different research results, specifically in implementation research, that is contributed to the development of evidence implementation. International Institute of Public Health, play a key role to conducting implementation research and synthesizing the existing evidence-based information and gathering different research findings and organize knowledge sharing platforms. And other academicians and various universities, professional associations, multilateral and bilateral organizations are also interested to conduct implementation research in various health issues. Recently, few private health research facilities have been established. It's interested to working on implementation research. Most research activities are supported by, collaborated with, financed by multilateral and international NGOs. Research institutions, most efforts have been exerted on research institutions conducted, but the institution conducted different research outputs, but there is a major issues identified, the gaps highlighted with most of the the national strategies, including the health sector transformation plan. Next slide. Even because of the poor integration and limited research facilities and collaboration with limited participation, because most of the research activities are conducted by the universities and most academic people are involved. So that is a poor integration of and limited implementation of evidences into policy and practice, because most research are not based on the national priorities. There is also poor integration, limited participation of stakeholders, as we earlier mentioned, because implementation research are a team work activities. It's not conducted by one. It's also limited advocacy is one of the limitation, because even when we disseminating efforts are made, most would be publication international and local journals that are not widely accessible, and academic research are too technical for program people to be placed on the implementation positions, and researches are conducted with non-academic institution. It's a bit more operational if being done with local sectors. Then the dissemination efforts are usually limited to technical reports that can be shared through the narrow circles. Next slide. So Pathfinder have a lot of experience in implementation research. It can be focusing for it's Pathfinder working to ensuring that all Ethiopians have an ability to exercise their sexual and reproductive health. It's a long history to partnering with the governments of Ethiopia to bring quality health service at the primary health care level. So all the circle and the practice and feedbacks are building their capacities. It is implementing for since 2060s, and the organization used an integrated and holistic approach on the life course along the continuum of care. The different technical areas are working integratedly. It's challenging for fragmented implementation activities with cross-cutting activities, with considering gender, health system strengths and qualities, and renovation and sub-grants. So Pathfinder has been contributor to strengthen the health system capacity to generate learning and implementation evidence, to inform what works, and fostering the use of evidence to make evidence-based decision making. It also integrated with the collaboration, learning, and adaptation practice in all aspects of the operation and the program to achieving better development outcomes. So the Pathfinder monitoring evaluation system is beyond monitoring evaluation, because it's focusing on how to move a good model to widespread use through generating practice-based evidences that can be translated evidence into practice to apply the local context in the health system areas. So all the integrations are contributed for as part of those efforts, what we have mentioned as a limitation. Next slide. Learning from the initiatives, Pathfinder committed to driving hybrid model to encouraging sustainable investing in capacity building to bridging the disconnect between implementation research, practice, and policies. So it provides technical and financial support or to the universities, research advisory council, research institution to be undertake implementation research in major public health issues. It established partnership with universities, research institute to vitally creating a new equilibrium and ensuring better evidence generation and use. And it also established regional knowledge hub to creating a regional evidence generation platform to bring together universities, stakeholders, and research experts who are working in the region and to generate and use evidence to inform regional health bureau and practice to creating sustainable regional responsive health system. And it provides capacity building, specifically implementation research with the collaboration of universities, and engage technical experts and stakeholders, including donor with research activity to ensure translation of research finding into written practice. That can be addressing the challenge as the intersection of research and practice and optimizing the stakeholders. Stakeholders also help to prioritize and facilitate the connection between knowledge and insights that emerging large priority areas. Since establishing an office in Ethiopia in 1995, Pathfinder committed to engaging in knowledge generation and sharing and also adoption of practices. Over 150 learning evidence were generated in different thematic areas, including conducting with systematic and meta-analysis. And it also shared more than 86 program learning published in different peer-reviewed journals, and more than 18 conference abstracts are presented in national and international conference. As I mentioned, adapting the practice, as indicated, various pieces of evidences were generated and published in preview journal. Those pieces of evidences were used to inform policy, fostering innovation and improving and sustaining the effectiveness of the current accessible interventions. More than 10 adapted program learnings have been used as an input for national policies and strategy formulation. Next slide. These are some of the lessons what we have learned throughout our implementation. And service providing agencies, including government and non-governmental organizations, have a challenge that needs to solution based on scientific evidence. So joint efforts help to pool resource and improve efficiencies. So partnership with different stakeholders, including scholars and university people and universities with development partner for a better evidence generation to demonstrate the feasibilities with further and better utilization to address the prevalent operational public health problem in Ethiopia. Also, it's collaboration to providing a synergies and foster bi-directional learning hub. So improvement of implementers in research activity will create enabling environment to test and adapt new approach, implementing findings effectively and efficiently. Next slide. These are some of the takeaways. So it's introducing for implementation research and creating a culture of learning. It needs to end-to-end approach to creating to strengthen the capacity of the health system levels, because we need to have hand-on training using different platforms. We need to involve different stakeholders, including universities, research units, and also research institutes. We need to also creating a knowledge and capacity exchange platforms. This is not a one-time activities. It should be a continuous process. It's sustaining and genuine demand for evidence at all levels and all practitioners, because evidence inform policies, policy also inform evidences, and also evidence inform practice, and the practice also informs the evidences. So we need to contextualize the knowledge management platforms, created different like generating, disseminating, and translating learning practices. So systematically and transparently engaging the stakeholders to open the black box of influencing the policy and the practice through implementation researches. One of the gaps what we have identified is funding. Government, bilateral and multilateral donors, NGOs and other stakeholders should be increasing investment in research and development on intervention that would be improving the quality of healthcare at the primary healthcare level. Thank you. This is the last. Thank you for your. So this is one of the motto what we have mentioned is quality. Quality data without translation is one of the things that can be affected. Quality data without translating evidence is impede, and translating evidence without quality data is blind. This is our motto to conducting and generating evidences and sharing and learning through the practice. Over to you, Prof.
Thank you, Dr. Baggala, for your wonderful presentation, including presenting us the Ethiopian experience. Do you have maybe a couple of points from your colleague? If you, otherwise, I can. It was interesting.
If we have
questions. If there are questions, you can.
Yeah, if we have time, maybe as a time of question and answer, I will invite my colleague to entertain some of
Thank you very much. So you have covered, expanded a bit on implementation research, the definition, differences with other researches like Dr. Kunle presented, Ethiopia's experience. Yeah, I agree also, basically it was most of the researches were led by academic institutions. So it was really mostly academic, and there were also evidences in that area. And now why universities are, university industry collaboration is an indication that the research that universities were doing were not that much effective in terms of bringing up change or improving people's lives. And then the Ministry of Health engagements quite recently, like in implementation research, particularly the RAC you mentioned, the Research Advisory Council, the TV Advisory Council. These are indications that the Ministry of Health is ready to use, and we have seen some examples as well. Also, the engagement of private institutions nowadays, international NGOs and interests, and the Pathfinder's experience since 1960s, definitely it will be an evolution, because implementation research is developing, through time and so on, making, separating itself from the other, academic or operational or other types of researches. So that's also great. And I think it was also interesting that how much you have produced from the Pathfinder perspective. Both of you have presented, really have said that, underlined, I would say, there is poor integration in least and middle income countries, poor integration, really where we have limited research facilities and collaborations. Interdisciplinary research is very low, it's less participatory, and less, we are also, we can say there is also limited advocacy, and I agree with that. And both of you have really presented these areas. So it is interesting. So now we can go to questions and answers. Maybe there are questions for Dr. Olakunle. If you can say, if you have seen the QA areas and also the chat. There are questions. For example, can we say in implementation research is a large-scale application of intervention research? So this is one of the questions.
Yeah. So I've actually, I've been. Thanks a lot, Prof. I've been responding to the question as they come. So some of these have typed answers to them already, and
Great. Thank you.
So the specific question that you picked out, I think it's both yes and no. Like I put in the Q&A chat. Large-scale intervention research could be implementation research to the extent that the questions that have been answered through that research focuses on implementation processes, focuses on understanding how context might influence those implementation processes, focuses on outcomes of implementation and trying to shed light on the mechanisms, the how and why by which the intervention really leads to an impact. But it will be no if the research is exclusively focused on the intervention, on just trying to prove that an intervention work or not, without paying attention to the process by which the intervention produces its effect. So again, it's an overlap, and that's really why I presented that diagram to show that a lot of these are really no clear boundaries, but we know what the broad distinguishing features of implementation research is, and we can look for those features across different types of research, be it intervention research, quality improvement, monitoring and evaluation, and so on.
Thank you very much. I mean, your diagram tells it all. So, so thank you for the explanation. And there are overlaps and also the distinctions. Maybe one question for Dr. Bakala. Maybe you have responded, I haven't checked. Maybe for all of us, particularly from least and middle income countries, what policy lever will encourage or promote implementation research in least and middle income countries? Both of you can really touch upon that. Maybe we can start from Dr. Bakala.
Sorry, actually, I've tried to see for some of the question. For the sake of entertaining and getting some additional points from Dr. Mengistu, I would like to invite him to say something about this, if he's alive there.
Dr. Mengistu, please.
Can you hear me?
Yeah, yes, please.
Yes.
Dr.
Okay. Thank you, Dr. Bakala, and thank you, Professor Getnet. And I would like to thank also the International Institute of Primary Health Care for taking this topic as part of your continuous involvement in creating this discussion. One area probably I would like to emphasize is considering that the end result of the implementation research is to improve the outcome of our program activities. I mean, if we are talking about health, I think improving the health status of people by really decreasing morbidity and mortality. So the whole issue of like, how can we really bring academicians, or we can really take in terms of like higher learning institutions with program implementers together, really one to fit the other. In terms of like an important area is there is a thought like always implementation research can be done by only the scientific community, which usually puts people from the universities, people from the research institutes or higher learning institution. But if that linkage can be created, then the whole issue, it's not only for the sake of, I think, generating evidences, but at the same time, in the process of generating evidences, we can build a lot of capacity within the implementers, within the public sector or private profit or non-profit organizations. That capacity will help a lot in terms of continuity of that evidence generation. So any of our implementation will be based on evidence. I think we know that there is a great knowledge practice gap or a no-do gap. The only way where we can really minimize that is create those linkages and really use evidence to really support our programs. And by the end of the day, whether I am a researcher, I am a scientist in a research institution, or an implementer, all of us needs to have a better health status, which can be really interpreted in terms of saving the lives of those who are benefiting from the services we provide. In terms of like policy level things, I think advocacy is very important. I feel some people from the ministry or other places might have been here in these meetings. And the whole issue is like not only government policy makers, but also even program policy makers really need to know that research is not for the sake of doing research, but the evidence generated from that will change the outcome. That is something which I want to add. Thank you very much. Back to you, Professor.
Thank you very much, Dr. Mangistu. Really, I know you have a very extensive experience in this area, and you are encouraging universities to engage in implementation research. And once upon a time, also we had a collaboration while I was working at Addis Ababa University, until even we produced a special issue focusing on your program. So thank you, I think, for stressing these areas like linkage, advocacy, collaborating, and so on. Maybe if Dr. Olakunle has some additional points, a kind of remark.
Yeah, thanks, Prof. Getnet. And I think, thanks to Dr. Mengistu, he quietly covered it. Just to say it in another way, that some of those levers include promoting a research culture. I think we cannot overemphasize that, particularly in a number of our low and middle income country settings. By that I mean across the board, people involved in improving health or improving healthcare delivery system should have a positive outlook towards research as a tool for achieving their goal. And this cuts across not just only people in academics, but practitioners as well, policymakers, donors. The whole idea is the implementation research is premised on teamwork, on multi-stakeholder collaboration, and so on. So that's really one clear. There's a need for an attitudinal change. There needs to be a shift in our attitudes towards research. And I also think we tend to think that we don't have resources for research. And I would beg to differ, because we always have resources for program implementation. We have resources for policy implementation. And by resources, I'm using that more broadly. It includes money, it includes people, and so on. And I think if we really do have that culture, we can leverage even resources that is geared towards implementation, to understanding and learning around that implementation. Just imagine that for every grant that we get or every policy that we get, we set aside like 5% or even 2% of the funding and of the staff capacity that is involved in that, in conducting research that will learn in real time, that will be used to iterate the program in real time. So yes, resource limitation is a challenge, but there are still opportunities even within our limited resources for us to be able to continuously learn and to improve. And I think we need to be more intentional in linking the different stakeholders involved in learning health systems. We need to be more intentional in formulating teams that cut across academics, practitioners, people who work in civil society organizations, community members, and so on. And I think what the IPHCE is doing is an example of that. We need more knowledge brokers. We need more organization within our context that intentionally brings all of these stakeholders together. And I think just the whole idea around also opening communication channels and advocacy, like Dr. Mengistu did mention, I think is also key. Communication has to go back and forth, top to bottom, bottom up, and so on. And I think we need to be seeking those platforms for advocacy, those platforms for communication and more effective dissemination. And that means that when policies are being formulated, I mean, all hands are on deck to be looking at learnings, that goes into that policy, and those information are provided in a timely fashion. We need to be more rapid for academicians. We need to be more rapid in the way we turn around evidence. We can't be waiting for 5 years before we can generate evidence for action. We need to really be more responsive to the pressing in implementation problem, while at the same time keeping a view on generating knowledge that is generalizable. So I think there's a whole opportunity and there's a promise. And efforts like this webinar we're having today is really a step in the right direction. Thanks. Over to you, Prof.
Yeah. Thank you very much, Dr. Olakunle. Really, I appreciate you. You addressed the commonest limitation that we mentioned, the resource limitation, and you looked at from a different angle. We can tap into other areas because we are running the program. And thank you for that. And I appreciate all the presenters, including Dr. Mengistu, for taking your time and addressing this very important issue. And I would close it by saying, what I read, what implementation science or implementation research means. It's know and do. So thank you very much. Over to you, Tersit.
Thank you, Prof, for a nice moderation, and the speakers as well for sharing their experience and everything. So I would like to thank everyone as well for attending the session. So I would like to say, stay in touch and follow us on our website, and we'll be sending or we'll be having also the consecutive webinar series. So there will be a short evaluation and a feedback collection link that Guru will be sharing. So please feel and share your feedbacks, and so that we could improve our webinar series to the best. Thank you so much, everyone.
Thank you all. Thank you.
Thank you. Have a good day.